I mean, after hearing that story, we all need to be aware of the signs, the symptoms, and the risk factors that can help catch lung cancer early, even if you have never smoked a cigarette in your life. To talk to us about that with us today is also Dr. Mohammed, thoracic medical oncologist with Cone Health Cancer Center and an expert in the lung cancer field. So we just saw that story. And so let's talk about how to prevent lung cancer in people who have never smoked.
Yeah, thank you, Tanya, for inviting me and to also highlight the importance of recognizing lung cancer in non-smoker. Definitely, lung cancer is still a disease of a smoker. Almost 85% of the patient that we see with lung cancer are either a smoker or former smoker, but there are around 15% of the patient never smoked a cigarette in their life, and they also can be diagnosed with lung cancer, which unfortunately they come to us in a late stage because non-smokers, they don't sometimes get the same attention as a smoker when they have respiratory symptoms.
Okay, so let's talk about what causes that lung cancer in a non-smoker, and are there groups of non-smokers at higher risk for lung cancer?
Definitely, non-smoker can get lung cancer for many reasons. The most common one is the radon exposure in indoor places. Radon is a decay gas that comes from uranium in the ground, and with our homes, which usually very closed, radon can be a very important cause of lung cancer. And it actually by itself is the second most common cause of lung cancer in general after smoking. Also, people with a strong family history of lung cancer and their parents or siblings, these are patients who are also at risk for lung cancer. There are certain occupations that can also increase the risk for lung cancer. Patient who works in roofing, painting, and other industry, aluminum industry. These are patients also that have risk for lung cancer. Secondhand smoking also is very important factor and causing of lung cancer in non-smokers.
Okay, so what signs should those non-smokers be aware of that could be a symptom of lung cancer? I mean, he said, you know, he kind of got passed on here and there until he finally said, no, I want to be seen in person.
Yeah, definitely. Again, lung cancer because the non-smoker, and that's what we try to get the attention of many of the primary care provider and other healthcare provider. That if you have a non-smoker who have persistent respiratory symptoms, please don't ignore it. Check it a little bit further. So, patient with persistent cough that is not disappearing, patient who coughed blood or sputum that is tinged with blood, patient who have shortness of breath for no cause, weight loss with no explanation. These people should be investigated further to make sure they don't have lung cancer or other type of cancer.
So there might be a few people who said, oh, I have that symptom or I have that symptom. So if they recognize that they're having these kinds of symptoms, who should they be contacting?
Their primary care provider is usually the best resource for them if they have persistent symptoms, because they are the one who's going to evaluate and make sure that they get the right test done initially. And if there is any concern, they usually send them to our multidisciplinary clinic to take over.
Okay, and you just mentioned a test. Is there a specific test that a non-smoker should have?
There is no screening test for non-smoker at this point because, again, the percentage of people when the non-smoker who get lung cancer is still lower than the smoker population. But definitely persistent coughs that did not disappear after flu symptoms or shortness breath that persisted could indicate some imaging studies, including chest X-ray or CT scan.
Okay, we're going to continue this conversation. Again, lung cancer is the leading cause of cancer deaths in our state. We'll continue this conversation right after this commercial. We'll be right back.